Today we're going to be talking about cultural implications for psychiatric mental health nursing. These are going to be especially important when you go to do your cultural interview and write your paper. You'll need to keep these things in mind while you're doing those. So the importance of culturally relevant care is that each culture is different. And these cultures are groups that have shared beliefs, values, and practices as well. And it influences the way they behave and the way they think. So there are some people in the minority status that consider themselves different. So it's a subset of people who are thought of as different, not only by themselves, but others. Ethnicity is a common heritage and history. It's different than a culture. They share a world view of thought, which means they think about the world in the same way. So current demographics in the United States are going to be changing soon. By 2043, it is projected that no group will be greater than 51% of the population. Not white, not Hispanic, not Asian, but the non-Hispanic whites are still going to remain the largest group, but it will be less than 51% of the population. This is in the United States. So Western tradition, that's us. The identity is found in individuality. So we value autonomy, taking care of yourself, independence, doing things on your own, self-reliance, not relying on other people. We value those, that somebody is autonomous. And we consider the mind and body as separate entities, not the same entity, which is a lot of times why we run into problems in our Western tradition in therapy. Disease has a cause, and the treatment is aimed at the cause. That's the way we feel. And we also believe that time is linear, that it goes on in a straight line, not on different planes. And for someone to be successful in the Western tradition, we believe that you need to prepare for the future and what's happening. Now, Eastern tradition is different than us. Instead of the individual, they believe the family is what the basis for identity is. And they believe that mind, body, and spirit are one entity, where we believe they're all separate. They don't believe time is linear. They believe it's circular and things recur over time. They also think that you're born into a fate, that you don't really have as much control over it as we do in the Western tradition, and that you do have a duty to comply with your fate. They also believe that disease is caused by fluctuations in opposing forces, for example, yin and yang. Now, in the indigenous cultures, they place the significance on humans in the natural world, meaning that they see the basis of identity as the tribe, that's the number one concern, and that a person is only an entity in that it's part of the tribe. They also think that disease is a lack of harmony between the individual and the environment. So culture and mental health. As I said, this is extremely important for any, not only for the projects that you're going to do this semester, but also for your nursing care. You need to be aware of different cultures. There's something called an enculturation process. And this is the culture's views that are transmitted to its members. As you're growing up, you learn from your family, from your church, from your teachers. All their culture's views, or the culture's views, are transmitted to its members. This is the enculturation process. Then there's ethnocentrism. This is the belief that your culture, or one's culture, is superior and better than any other culture, and that it's the right culture. And cultural imposition is exactly how it sounds. It's you imposing your culture on a client or a patient or on someone else, instead of allowing their culture to help dictate what type of care they will receive. So some barriers to getting quality mental health services in relation to culture are communication barriers. Not speaking the same language is one of the biggest, of course. Not knowing who to talk to because you're not sure how to talk to them. Misdiagnosis is a huge thing. Sometimes cultural concept of a disease is that it's not a disease, it's related to the environment or it's related to the yin and yang, and they don't believe that there's a medical cure for that type of disease or that it's even a disease. They may consider it a process or a phase. Somatization, how the person is allowed to express their illness in mental health. Some, it's you keep it to yourself, you don't let anybody know, or others, it's you're loud about it and you share it with everybody. Culture-bound syndromes. So these are things that only exist in certain cultures. So they consider it more of an expression of distress, kind of like what I was talking about before with somatization. But they have something called a wind illness. They believe mental illness can be caused, or an illness can be caused from too much cold or too much wind. So it's only seen in certain cultures, and it has specific names only seen in that culture. So there are genetic variations in the pharmacodynamics as well. For example, if a person goes in for treatment for mental illness and the doctor might say, have you ever had this before? No, I've never had depression or anxiety. Has anybody in your family ever had depression or anxiety before? Well, yes, my mother. Do you know what medication she was on, if any? Well, yes, she took Zoloft. So if the doctor wanted to prescribe an antidepressant, a lot of times they will prescribe the same one that worked for somebody else in their family. There is that genetic variation of what things will work. Not everybody has the same receptors for each of the medications that are used, and it tends to be genetic. And lastly, let's talk about the stigma of mental illness. This is something that is huge in our society and in a lot of societies and a lot of cultures. It is one of the major barriers that prevent people from seeking help or telling anybody what's going on. In some cultures, the person with mental illness is kept away from other people, not let out into the house or out of the house into public. So one of the things I want to help work on during this course is helping you reduce the stigma you might feel or you might have heard about in the past by the various projects we do, including the cultural interview and paper. And that ends the lecture for today. I was wrong. This doesn't end the lecture for today. There is more. Populations at risk of mental health and inadequate care. Why are these people, I want you to think about this, why are people, immigrants, refugees, cultural minorities, why are they at risk for inadequate care? So think about that for a minute. Is it lack of money? Lack of services? Lack of knowledge, where to go? It could be many of those things. Not having any insurance, not knowing where to go. So there's something called cultural competence for psychiatric mental health nurses. And there's 5 constructs, which we're going to go over individually, of how to become culturally competent. The first one is cultural awareness. First, we need to look at our own beliefs, values, and practices of our own culture and look at what we believe. and recognize that during a cultural encounter, there's going to be three cultures that are intersecting: yours, the client's, and the setting's culture. Mental health has its own culture as well. A lot different than a normal hospital culture might be. And then there's cultural knowledge. How do you become knowledgeable about different cultures? Well, you go to different cultural events and programs. You might forge friendships with the diverse cultural groups, which is very common in the medical field, because there are a lot of different cultures that practice, that hold medical positions and healthcare positions. Studying about a culture. And here at Harper, it's one of the things that they promote. Also, learning different cultural differences helps nurses, helps a person establish rapport if you have some type of understanding of that person's culture, and being able to ask the right questions. And that way you know which variables need to be considered in providing care. Cultural encounters. Sometimes the more you encounter different cultures, the less stereotyping you might do when you meet that group again. And these encounters help nurses get more confident in cross-cultural interactions, and it helps avoid or reduce cultural pain for the people that might be being cared for. Cultural skill. The ability to perform a cultural assessment in a sensitive way. Becoming skillful, using appropriate terms to do the assessment. Sometimes the person might not even speak English, and you may need to bring in a professional medical interpreter to ensure meaningful communication. This means not using somebody on the floor who's not a professional interpreter, especially medical, because a lot of the words are different in languages when you're talking with a medical interpreter and you're talking with a layperson. Also, to use culturally sensitive assessment tools. If you use an assessment tool that has a lot of words that the person doesn't understand, it's not going to be an accurate assessment. So the goal is to have a mutual agreeable therapeutic plan that's culturally accessible and acceptable. So if the person says, well, if I was at home, I would do it this way, and it's something that can be done in the office or in the hospital, then it's something that needs to be incorporated into their care, such as a type of soup, if that's allowed. And a therapeutic plan needs to be capable of producing a positive outcome. Cultural desire. So mental health nurses need to have a genuine concern for helping the person, for their welfare. They have to have a willingness to listen to the patient's viewpoint. And they need to have patience and consideration and empathy. And you're going to hear empathy a lot over this course. Empathy meaning the ability for you to put yourself in someone else's shoes rather than be able to sympathize with them. It's a little bit different. Not to say, oh, I experienced that myself. That's sympathy. Empathy is to be able to put yourself in other people's shoes. And hopefully this will be developed as the course goes on. And this is now the end of this lecture.